everybody, welcome to my talk today that aims to support any of you who have group work or group-based discussion as part of a nursing interview. More nursing degrees and registered nurse or nursing associate interviews at all levels now are using group work sometimes to observe for key skills. Hope you find this video helpful. If you've got an interview coming up, remember, if you do find it useful, give me a thumbs up on YouTube. And if any of you've got other helpful tips that work for you when you had a group interview, then please do share them in the YouTube comments to support other people. So my first tip is to understand the aim of group work. What is the interviewer looking for? What are they evaluating and assessing? And you may not know what the group work is going to entail until the day, or you might have an idea. They might give you a title before the interview. But what you should know is that interviewers are going to be observing how each member in that group is interacting, how they're behaving, how well they complete the group work and the task set. So interviewers will be observing each member using a feedback form. So each member of the group will be have a feedback form, and there will be a point system or an assessment grid. So your performance during the group work is being assessed and evaluated as an individual. So if you choose to say nothing during the group work, you're not going to get many points. On the opposite side of the coin, you shouldn't talk too much and over people and not listen to others and dominate a group discussion. Other people's opinions need to be facilitated as part of the group work. The sort of areas being observed and evaluated usually link to several of the following areas. So the first is how well they complete the task. How have you handled the task that you were given? It's looking at effective communicate. Are you an effective communicator who listens to others in the group? They're looking to see that you're a team player who demonstrates effective teamwork to complete a task, and that you complete or you contribute to the group work set, that you're non-judgmental, that you're respectful, you're kind, or you're compassionate. This would especially relate to a discussion. So sometimes you might be given an ethical discussion, for example, where people in the group might have different opinions, which is fine, or you might be given an issue that might be slightly controversial to discuss. So an example might be, should people who smoke have access to cardiac surgery? And people will have different views about that. Should people pay for an ambulance if they have an accident when they're drunk? Controversial. Should we pay for mixed GP appointment? If we miss a GP appointment, should we start charging people for that? So all the interviewers could be assessing your organisational skills, that you use a systematic approach, that you're a critical thinker, or that they might assess your leadership skills. It depends on the type of role that you're going for. So for example, for a leadership role, they might have a set task, paper-based, or a physical task that needs completing. You might be given flip chart paper, for example, and asked to complete a task where you're setting some priorities, or you're planning an improvement program, for example, some priorities, and that you're leading a team. So it just very much depends on the role that you're applying for. So a few more tips on what the interviewer is looking for in a group interview. Firstly, remember, if you have an interview all day or all morning and afternoon, which is often the case with a group interview, you are being observed throughout that time, and that includes before the group work and after. So don't start scrolling through your phone, messing around with other candidates, and generally being unprofessional during that time. So act as you would if you were sat in a standard interview before, during and after the group work. And I have seen that happen in group interviews that I've been involved with, where some of the candidates were very unprofessional, were messing around, showing each other videos on their phone. If you need to use your phone because you've got childcare or whatever, you can ask to go out, not obviously during the group interview, but you might say it to the interviewer that you just need to take a phone call before. So if you're unsure about anything or feeling anxious, don't hesitate to tell someone. Interviewers expect candidates to be nervous and should support you through this. So just try to do your best. And I have a video with some tips on to help nurses overcome their nerves in interviews. So do check out the other videos on my YouTube channel. So as I said, I've got a video on overcoming nerves. I have a video on preparing a presentation for a nursing interview. And many interviewers now will have a selection of different activities. So you might have to do a presentation, you might have some group work, you might have a technical standard interview, and also a video on questions to ask at the end of any nursing interview. So I hope you find those helpful. If you know you have group work as part of your interview, it's important that you prepare and do some background research. It's very important if you know you have group work or a group discussion, as there could be a discussion or a debating statement about a current topical issue in nursing. So I would suggest that if you're applying for a degree, for example, you understand the role you're applying for. You can look on reviewing a job description if it's a role, networking with others, other students or staff that are in the role that you're applying for. Attend an informal visit or an open day at university if you're applying for a degree course, and you can ask lots of questions to increase your understanding. If you're going for a degree course, you can review employer websites, professional national websites, the NHS websites, and download the course handbook. And if you're applying for an educator role or a specialist nurse role or a leadership role, you can do your background research linked to educational standards, for example, or leadership policies. And it is really dependent on the role that you're applying for. And I've released lots of helpful videos linked to generic tips and some more specific guidance on nurse education, advanced practice or nursing leadership to support interviews and to signpost some of those areas. So do check out the videos on my YouTube channel. So these are just a selection of some of those videos that you might find helpful. So one of the most important tips as well as preparing is to keep to the brief and the task set. It's very easy to go off on a tangent when doing some group work, especially if one person in the group tries to lead and the group goes astray, or one person dominates down the wrong route. And if you think this is happening, don't be afraid to say, can we just check that this is what we're supposed to be doing, and refer back to the directions given. It's helpful for one person to read out the task slowly and clearly at the start, and this may be you might want to volunteer to do that. And sometimes the interviewers will do that, they'll read out the task, but other times they will place directions in the middle of a table, for example, and so you could take on that role to read out the directions. Don't worry if you don't want to, but someone has to. Take time to read and reflect on what is being asked to do. And you might want to say, shall we all take a minute to reflect on the directions as a group? You're taking the initiative, you're being systematic, which is good. If it's a physical group task of building something, or is it a debate or a discussion, or do you have some written work to complete at the end of the task? So being really clear on what you're being asked to do. Are you expected to summarise your discussion on a flip chart? So you might go so much into the discussion that people forget to put the discussion on the flip chart, and you don't want to interpret those instructions incorrectly. So what exactly is the aim or the goal of the group work or the task set? For example, are they expecting you to discuss a health related topic as a group? And individuals might have different views. We all come from different cultural backgrounds, we've encountered different social experiences, and we've got different opinions, and it's important to do the background research and reading to answer a debating statement or question, as I mentioned earlier on the previous slide. For example, what does person-centered care mean, or what does transformational leadership mean to you? And what is each group member is expected to do as part of the group work? Do group members have specific roles or different roles? Does one of you need to be given the role to write down on flip chart paper, someone to keep an eye on time, for example? So being clear on what the expected outcome is. And it is helpful to use a systematic, structured approach where possible. So, for example, shall we first gain opinions from the group, then start to write down? You might separate your actions into two parts. And the main thing here is don't lose sight of the brief or task set, as it's easy to go off on a tangent and lose sight. And if you sort of pull people back and say, you know, use the directions as your guide, that shows that you're organised and that you're sort of leading and taking the initiative as well, if that does happen. So some tips during group work: always try to contribute in some way, however little. Say something supportive, or physically help with something if it's a physical task like building something out of materials, or if you're devising objectives for a project plan, if it's a leadership role. Just try to be proactive and contribute in some way, however small. Be respectful of different views. You can have different opinions. Think before you speak and support your opinions with research or experiences where possible. But you're trying to get that balance of not talking too much. Don't ever talk over people. Show active listening, and if you're unsure what to say, you know, you're not quite sure, just listen to others first, then speak. And that's a really helpful strategy, as you can acknowledge people in the group, build on what they say, having, you know, on what they've said, and then give your own view. And it also helps if you're a little unsure or confused of the topic area, for example, and it sometimes can spark an idea. Keep your points concise and informed where possible. So, for example, underpin your views with your background research or personal experience, and try and keep calm and never shout over others during group work. Another key tip is to think about your language. It needs to be positive and supportive language. So try to offer an informed and balanced view, and disagree respectively using positive language. So instead of stating, I completely disagree with you, or making a judgment on someone else's view, I can't believe you think this, acknowledge the other person's opinion positively and respectfully. So that's an interesting view. However, I have a slightly different opinion, is a better way of saying it. Or I respect your view, however, and then you can give your opinion. It's also helpful to have a plan or a structure. For example, shall we go round as a group and each offer our view? So you're looking at being really supportive in the group, especially if you see that somebody hasn't spoken. Give them the opportunity, and it shows that you're being inclusive and you're kind to others, and because others might be very, very nervous. So similar to any other type of interview, it's important to prepare the day before and the day of the interview, because remember, you want to be in the best frame of mind when you're in your interview and doing your group work. So simple things like making sure you've got the correct time, the day, the location, get your outfit ready. It's going to keep you calmer than if you're rushing around and stressed on that morning looking for a clean shirt. If you've got to think about the virtual interviews as well, because sometimes group work is run as a virtual session, and you can still adhere to the same principles of being respectful, not talking over people. And it's helpful to use some of the tools, and if you've not used them before, on virtual platforms. So for example, there's a little hand that you can put up before you speak on a virtual in a virtual meeting, and if you don't know how to do that, then ask and try and find out before. And if you hear lots of people talking over each other, then suggest that the group use the tools, or you can write in the comments section if you do have a virtual group group work. But often they're usually, where possible, it will be face to face, but we never know what's going to happen with pandemics in the future. Hopefully we won't have any more. And as I said, getting your clothes ready, prepare the room and background for a virtual interview as well, and making sure that you have a good night's sleep the night before, you're hydrated, you've eaten, and you're not overly tired, dehydrated or hungry. So I hope you found this video helpful. I wish you every success in your interview, and if you've got group work, good luck. If you've got any questions, do put them in the YouTube comments, or DM me privately on Twitter, my website or my YouTube channel. Good luck. If you're interested in buying my books, there's information in the description in YouTube. And if you've had a group interview, do share your thoughts and anything that helped you in that interview for others in the YouTube comments as well.